Hello, everybody, and welcome to the Thursday edition of Video Clips, which is brought to you by Wellness Forum Health, the Wellness Forum Institute, and Make Americans Free Again. Our 6-week boot camp started this week. Yoga every week, strength training every week, cooking class every week, health lecture every week. So you're going to get a lot of education and motivation and assistance and help in your health journey. You can still enroll. We tape all this stuff, and we'll be creating a section in the documents tab of the members site for those of you who are members, so you can use this material as your workout and yoga classes and that sort of thing for a long time, not just limited to the 6 weeks. So if you're interested in information, you want to sign up, send me an email. I'll be happy to return a description, and we can get you signed up and participating next week and for the next 5 weeks, either live or on video. And we'll get you the video recordings of this prior week. Conversations with Pam, the book, is now available. If you call the office, you can order an autographed copy, and you can also order some fruit and nut crunch bars and smoothie mix ingredients and all that other stuff. Super excited about this book. It tells the story of Wellness Forum and Make Americans Free Again, and a lot of history about public health. It brings us to the present, and there's a real call to action. So I hope you like it. Please read it, give me your feedback, and I hope you spread the word about it. But I'm super happy it's done, I'll tell you that, and really super happy to see it out there, and already people are talking about it. That's great. I have a lot of news to share with you today that I think is super important. And so this video might be a tiny bit longer than usual, but I'll try to make it really interesting for you. I just want to say publicly, I feel so bad for Charlie Kirk's family. This assassination was a horrible thing. It's a reminder that we live in scary times, not so different than COVID, actually. It was only 3 to 4 years ago when I was getting death threats because people disagreed with my stance on masks and lockdowns and school closures and mandating experimental vaccines. So really, nothing has changed. Easily brainwashed and stupid people can't handle listening to a difference of opinion and think the answer is to threaten and even kill people who they don't agree with. There's no reasoning with them, but there are a lot of them. I'm super careful these days, and I'm reminded that our country is still not a safe place to live. Its problems are not solved, and we still have work to do as citizens. Speaking of lockdowns and nonsense, somebody asked me the other day, what happened to bird flu? I don't hear about it anymore. And you don't. And I'll tell you the reason. The current administration doesn't have any interest in damaging farmers and increasing the price of food and creating food shortages or shutting down the world. So they just stopped it. You don't hear about it anymore. But, and this is important to remember, another administration could have a different idea and revive bird flu and start it all over again. So it's just another reason why we shouldn't be relaxing and thinking our problems are solved. The third thing I wanted to mention is a study conducted by employees at Henry Ford Health, a large healthcare system in Michigan, shows that there is a direct connection, it appears to be a connection between childhood vaccines and sick children. That isn't news to this group, I don't think. But the story of the study is newsworthy. Infectious disease specialist Dr. Marcus Servos and his colleagues studied 18,468 children born between 2000 and 2016. The data that they analyzed were taken from the system's insurance plan, which included information from medical, clinical, and payer records, and they also got data from Michigan's immunization registry. At 10 years, 57% of vaccinated children had a chronic health condition like asthma, while only 17% of the unvaccinated children had a chronic condition. The authors wrote, quote, this study found that exposure to vaccination was independently associated with an overall 2.5-fold increase in the likelihood of developing a chronic health condition when compared to children unexposed to vaccination. The association was primarily driven by asthma, atopic disease, eczema, autoimmune disease, and neurodevelopmental disorders. This suggests that in certain children, exposure to vaccination may increase the likelihood of developing a chronic health condition, particularly for one of these conditions. The reason why people are talking about the study right now is that it was discussed during a Senate subcommittee hearing. Someone at Henry Ford Health has acknowledged that researchers there conducted the study. It was never published, most likely because it didn't support the safe and effective narrative. The study is provocative. It should have been made public and should have led to more investigation. It's not the only one, and it's a reminder that we're nowhere near integrity in medicine. We're a long way from that, and I'm not sure that integrity in medicine can be reestablished in the existing system. And the next story I'm going to share with you is an example of that. Larry Black was a 22-year-old patient in SSM Health St. Louis University Hospital, admitted after being shot in the head on March 24th, 2019. A week later, he was taken to surgery to have his organs removed for donation. The problem was that his heart was still beating and he had not been declared brain dead. Just as the team was getting ready to operate, Dr. Zani, Black's doctor, came running into the room and demanded that the team stop. They did. Today, Black is 28, a musician and the father of 3 children. He requires physical therapy because he has lingering issues from the gunshot wound, but he's very much alive. And what's even more important is he remembers clearly the events that led to his almost murder. Quote, I heard my mama yelling, he recalled. Everyone was there yelling my name, crying, playing my favorite song, sending prayers up. He said he had tried to show everyone in his hospital room that he heard them. He recalled knocking on the side of the bed, blinking his eyes, trying to show that he was fighting for his life. The way the entire debacle started, and the whole story is scary, and I'll summarize it for you here. Black was shot on a Sunday morning or Sunday afternoon on the way to his sister's apartment. He crawled to the back door of a woman's house where he asked for help. Before an ambulance took him to the hospital, Black told his sister, Mikkel Payne, not to worry about him. He said, I'm good. Black said he went in and out of consciousness on the way to the hospital. Once there, he recalls hitting his head on the side of the bed to get someone's attention, and one of the nurses said, oh, that's just a side effect of medication. Payne said she asked her brother to blink twice if he could remember his first pet, a dog named Little Black that looked like the Chihuahua from Taco Bell. Black said he remembered blinking twice. His sisters remember the same. Payne asked him another question. This time she wanted to know whether her brother recognized their family. Black said he blinked twice when he saw his mom and sisters standing nearby. Black said his sister then asked him the main question, which was, did he want to give up or did he still have the will to live? And he started blinking and hitting the bed to let his family know that he was still with them. Black's sisters said hospital staffers told them that movements were involuntary. Then a woman from the organ procurement organization explained to the family in the waiting room that Black had indicated that he wanted to be an organ donor on his ID. Mikkel says her mother said it was too soon, but the woman was persistent and insisted on leaving brochures. Eventually, the medical team reported to the family that Black was at the end of the road. Payne said she thought her brother still had a fighting chance and asked the hospital staffers to take another look at him before he was wheeled down the hall. I'm like, my brother's in there tapping on the bed. They said that's just his nerves. But I'm like, no, something's not right. It's like he's too alert. He's letting us know, please don't let them do this to me. I'm here. I can fight this. They replied that that's what the medicine will do. It affects his nerves. A person can be pronounced dead in 2 ways. A person is legally dead if their heart stops beating and they stop breathing, which is when donation after cardiac death can occur. A person can also become an organ donor if their brain, including the brain stem, has irreversibly ceased functioning, which is when brain death donation can occur. Black didn't fall into either category, as doctor said, and he said Black hadn't even had a brain death exam. Dr. Zani said he informed his chairman about the situation, then started running through the halls to the operating room. Black's family was waiting in the hallway, and Dr. Zani pulled them into an empty operating room nearby. I remember he told my mama, I can't kill your son, Payne recalled. She said, excuse me? Dr. Zani put an image of Black's brain on the screen. Then he circled the part of the brain that was damaged. He explained that Black's gunshot wound was something that could possibly recover from, although he might need therapy. He asked the family whether they were willing to give Black more time to heal the injury rather than withdrawing care. The doctor said, in my opinion, no family would ever consent to organ donation unless they were given an impression that their family member had a very poor prognosis. I never had a conversation with the family about the prognosis because it was too early to have that discussion. The doctor also added, and this is the scariest part, that he knew he was taking a professional risk when he ran into the operating room to intervene. So a physician in a medical facility saving his patient's life, and he was very much alive, as the story shows, knew he was risking his reputation to do it. Well, here's what my advice to you would be. Make sure you get organ donor off your driver's license and ID. Remove it from the National Organ Donor Registry as well, because as long as it's there, having it off of your driver's license won't matter. Make sure your paperwork is in order and that 2 to 3 family members or friends with power of attorney understand this and are willing to advocate for you if you are, God forbid, ever in this situation. All of this is a reminder that the medical system is crumbling, and I don't think it can be trusted or fixed. Hospitals and medical centers are not safe places for sick people. The system itself is beyond repair, and we need a new one. And what it takes to have a new one is a lot of people. Our organization, Make Americans Free Again, started when there was nothing to do but MAFA meetings. The world was shut down and people were scared something bad was happening every week, and people were just assuming something bad was going to happen next week, and it usually did. Today, there are lots of things to do and places to go, and the threat doesn't seem so imminent. So, what do we do now? Well, here's what I think. First, we understand the importance of close connection of people with people of like mind, and we agree to congregate for that reason. Perhaps not weekly, but regularly, at least once a month. We need to have people of like mind around us that we can depend upon. Second, we recognize that as long as people are seeing doctors, and let's face it, sometimes you have to, or being admitted to hospitals, lawyers are needed both to make sure that people aren't killed for parts, to sue for failure to follow informed consent laws, and for when things go horribly wrong, due to staffing issues, stress, factors like mistakes. Third, very loud groups of health professionals and public health officials and elected officials are believers in mandates. Crazy laws have already been passed in many states that take away rights for kids and mental health, vaccines. More are coming. We're not done with any of this yet. And fourth, if we want a new healthcare system, we're going to have to gather up enough people to start one of our own. I think all of these are good reasons to build a strong consumer movement with tribes in every neighborhood and to donate money to make sure that we have good attorneys on retainer and to plan for the future. And I think the future that I envision is that one day we have enough people gathered under one tent, the informed medical consumer tent and the informed medical freedom tent, because those two interests are very much intertwined, that we can flip the switch and have our own single payer system and that sort of thing, offering people real choices with healthcare, the opportunity to make choices for themselves, and the types of things that I report every week, the disasters that are going on, no longer affect us. So how do you help with that? Donate to MAFA, start a tribe. We're starting to see new interest in starting tribes. That's a really wonderful thing to see. Attend tribe meetings, become an informed consumer, know better than the people in the hospital who have an opportunity to hurt you or kill you in some cases. I do want to say there are plenty of good people in healthcare, but the likelihood you're going to encounter one of them now, not so great, really. So if we want to solve this problem, if we want it to be different, it's up to us to solve it. So start a tribe, donate, attend the tribe meetings, become a member of Wellness Forum, get informed, know better than the people that you're hiring to take care of your health because you need to. And tomorrow's newsletter, a newsletter will go out to all the MAFA memberships. So if you're not yet on that list, go on ahead and join online at makeamericans.freeagain.com. I apologize for going a little longer than usual, but these were things I really think that you needed to know about. So I wanted to take some time to explain them. All right, as usual, pass this on to anybody who you think would enjoy learning from me and learning about what we're doing. And I'll be back to you next week with more news. Thank you so much for watching.